Hello everyone. Today we will discuss about the external markers of infective endocarditis when we are dealing with general physical examination of a cardiovascular system case. So, signs of infective endocarditis. Students, when presenting cardiovascular system case, usually mention that there are no signs of infective endocarditis, there are no signs of rheumatic activity. So we have to know what are those signs with the mechanism for those signs to get established in a case of infective endocarditis. So signs of infective endocarditis. Here, to simplify this topic, we will use the famous mnemonic for the features of infective endocarditis. I hope many of you are knowing about that. So it is called as from Janes. From Janes. I hope you remember a mnemonic, similar mnemonic for the features of rheumatic fever, that is Jones. Even the criteria for rheumatic fever is named after Jones. Here it will be from Janes. Okay, so we will see what does it mean. F stands for fever. So we should remember that whenever we are dealing with a case of a cardiac lesion with fever, we have to consider possibility of infective endocarditis. That's why it is given so much importance. Then R stands for Roth's spots. So R stands for Roth's spots. Roth spots are the findings which are seen in retina. So when we see retina through fundoscopy, there will be hemorrhagic spots. So these will be hemorrhagic spots. Hemorrhagic spots with central pallor. Central pallor in retina. So this is about Roth's spots. O stands for Osler's nodes. O stands for Osler's nodes. So these are the nodes which will be present in the digits, the pulp of digits. So common site will be the pulps of digits. And these nodes will be tender. So painful nodes, tender nodes. And commonly asked thing is, what is the mechanism of these nodes? See, in infective endocarditis, we know that the endocardial layer is infected with commonly bacterial microbes. So this endocardial layer with walls, there will be some vegetations over the walls. So there is infection and some micro abscesses or vegetations, bacterial vegetations. Vegetations will be there. Okay. So for this infection, there will be immunity, the fight from the immune system, leading to immune complex formation. So this will lead to immune complex formation. Now these immune complexes will travel in the blood and they will start depositing at multiple sites. This is first thing. Then we know that there are vegetations which are easily pliable. So these vegetations will be embolized to different sites in the body. These two are the mechanisms. So here also some vegetations and immune complexes will travel to the vasculature of the digits, leading to vasculitis of that particular structure, that is inflammation. So there will be vasculitis of digital arteries. So this will be associated with inflammation, and because of the embolized micro abscesses, it will lead to pain. Then comes M for murmurs. So here mainly changing murmur. Changing murmur is very, very significant. Then J stands for Janeway patch. Janeway patch. So what is Janeway patch? These will be the reddish discoloration of the palms and soles. So erythematous discoloration of the palms and soles. And this patch will be non-tender. So non-tender erythematous hemorrhagic patch over palms and soles. Palms and soles. the mechanism for Janeway patch is almost similar to what we have explained for Osler's nodes. But this will be painless because it will not involve the nerve fibers of the dermis. So it will be non-tender because of non-involvement of nerve fibers of dermis. This is the only difference which will make this as non-painful lesion and Osler node as a painful lesion. That is about Janeway patch. Then A stands for anemia. So when we are looking at signs, it will be nothing but pallor. There will be pallor, and from the Pickle series, we have to remember that along with pallor, there will be clubbing in infective endocarditis, which is a reversible clubbing, which I have explained in the video of Pickle series about clubbing. Then comes N. N stands for nephritis, that is glomerulonephritis. Glomerulonephritis. Again, here the immune complex deposition in the glomerulus. Immune complex deposition in glomerulus will lead to glomerulonephritis. Then E stands for embolic phenomena. Embolic phenomena. Sometimes these infective endocarditis individuals might get micro abscesses as embolizations in the brain also, leading to brain abscess. So this is embolic phenomena. Then S stands for two things. One is splenomegaly. Splenomegaly. For this, the mechanism will be again excessive clearance of the immunological complexes by the spleen. So it will be acting more. That's why leading to splenomegaly. So immune complex mediated mainly. Immune complexes. Then one more S stands for splinter hemorrhage. Splinter hemorrhages. That is, in the nail bed, we will be able to see red streaky lines. Nail beds will have red streaky lines suggestive of splinter hemorrhage. So these are the things suggestive of infective endocarditis. This is just to remember the features of infective endocarditis. But when we are dealing with the general physical examination in cardiovascular system and when we are commenting the signs of infective endocarditis, here few things should be considered. As we know, fever, obviously it will be a symptom. So this is not a sign of infective endocarditis. Roth spots, yes, we can consider. Osler nodes, we have to check for. Changing murmur, yes, it is a sign. Janeway lesions, yes. Anemia, pallor and clubbing, yes, you can consider. Glomerulonephritis, usually it will be detected using laboratory tests. So no need to mention it under the signs of infective endocarditis. Embolic phenomena, again, with the history and the neurodeficits, all those things will give a clue about embolization. So again, no need to find out externally. Then comes splenomegaly. Yes, we have to consider splenomegaly and splinter hemorrhages in the nail bed. So you got the external markers or signs of infective endocarditis in the same mnemonic, that is from genes. Hope it helps you in clinical examination. Do subscribe our channel for more such academic videos. Thank you so much.